Well, what we're given to understand is that there's a major restructuring process which is likely to be undertaken at Religare Enterprises. The biggest part of this restructuring process, according to our sources, is expected to be a move where Religare Enterprises, under a scheme of arrangement through a share swap ratio, lists its health insurance subsidiary, that is Care Health Insurance, directly on the exchanges. What we've been given to understand is that the plan to sort of put Care Health Insurance under this share swap ratio and list them directly on the stock exchanges is likely to be firmed up and announced by the next quarter. Importantly, what makes this move interesting is the valuation of Care Health Insurance itself. Very recently, about a couple of months ago, a rights issue was conducted towards Care Health Insurance, and that valued the company at about 14,500 crore rupees. According to our sources, as far as this direct listing of Care Health Insurance is concerned, through the share swap ratio, that could value Care Health Insurance anywhere between 16,000 to 17,500 crore rupees. That is similar to what its peers listed at about 6.5 times price to book value. And importantly, Religare's own market cap is about 8,500 crore rupees, which is nearly half of what its health insurance subsidiary, Care Health Insurance, could get through this particular listing. Religare, importantly, owns about 62.8% stake when it comes to Care Health Insurance. This is the biggest piece as far as the restructuring process is concerned. Apart from that, we've been given to understand that Religare Enterprises will, after the listing of Care Health, will focus on broking and lending business. And there are certain important appointments which are expected to be made over the next 2 to 3 months. These would include the Chief Compliance Officer, the Chief Company Secretary. All those appointments as a part of the cleanup exercise and the restructuring process expected to be made over the next 2 to 3 weeks, and the important piece thereafter of putting Care Health Insurance under the share swap ratio and listing it.